Hello, ThedaCare. I'm Imran Andrabi, President and CEO. Glad to be here with you. And today I have Megan Manahan, who's our Chief Brand Officer, with me to my left, and also Maggie Lund, who's our Chief HR Officer, on my right. I feel very privileged to have these two team members with me. And what we want to do today is to have a conversation between us and with you about our brand culture. We know our mission is to improve the health and well-being of our communities, empowering each person to live their unique best life. I love our mission statement. It has so much packed into it, and really what we want to talk about today is how does that come to life in each and every day's work that each and every one of you is doing. And then the other component of that is really to reinvent healthcare. Things are changing very rapidly. We have to be on our toes, we have to be ready, we have to be proactive, we have to be creating value in everything that we do, and truly be a partner in a proactive way with the people in our community. So with that said, let's turn to Megan and maybe have her talk to us a little bit about what brand culture is all about from your perspective.
Sure, thank you, Dr. Andrabi. And I think when we think about Life Inspired, it's really about a movement. And for us to have a movement to a healthier community, we need to start inside, and that's with our own team members. And to do that, we really need to inspire our team members and empower and engage them in living our promise so that we can achieve that reinvention. And I think there's so many opportunities to do that in our everyday work that we need to begin there. That with our promise and living our mission and values.
So Megan, one of the things that we've been talking about is our game changers, and I didn't elaborate on that earlier. We've identified 3 game changers. One is brand culture, which really is the root of everything and individuals within our organization and how they get set up to really do the work. The second one is really our clinical operational model. Which is, how are we going to deliver care, how are we going to deliver quality and safety, and how are we going to deliver that value every day. And the third one is, our business model of the future, which is, what is this business of healthcare going to look like? So could you talk a little bit about how these 3 components come together from a brand culture perspective in your mind?
I think the idea of brand culture supports the other game changers because in order to achieve that reinvention and to the clinical and operational model, again, that requires that culture of engagement. And I say, Maggie and I say this all the time, brand culture, 2 sides of the coin, right? That you need to live the brand inside through your team members and the culture and the team experience so that you can translate that externally. And I think that's why M&M, as we call ourselves, are the tag team on that brand culture piece. But they all intersect, again, with the goal of our mission, vision in mind.
So Maggie, I'm going to turn to you and ask the same question and get your flavor on this. You're the Chief HR Officer. And many times we talk about culture and who's the bearer of culture. And it's not HR, it's all of us. We are all sort of, the ambassadors of the culture at ThedaCare. So tell me about why culture is so important in our journey as we move forward.
Thanks, Dr. Andrabi. So as you said, we are the culture. So we create it and how we act and how we work across ThedaCare. So in addition to our mission and vision, we've created values and principles. And our principles are agility, right? We have to be agile in everything we do. Leadership, we're all leaders. It doesn't mean that you're a leader just because you have a title. We want excellence in everything we do. I would say compassion is another value. And I would say if you don't have compassion, this is not the place for you. We have to have compassion not only in how we treat our patients and our customers, but also in how we treat each other. And then we also have innovation. So the healthcare of today is not the healthcare of yesterday, and it's not going to be the healthcare of tomorrow, right? So we have to have innovation so that we're able to deliver on the promise that we're espousing to our customer and to our consumers. But it means that we have to do that, as Megan said, internally first. So how we treat each other with excellence, with compassion, how we treat whoever comes into our doors with excellence, with compassion, with leadership. It matters, and that is what defines the culture.
Thank you. So, recently you've brought in a company by the name of Root, and some of us have had the opportunity to work with them in the past, and they really help us think about current state, as they call the canyons in the current state or opportunities, right? And then to help us form or formulate what the future state looks like. So could you talk a little bit about this engagement and what does this mean? Because you've gone out and engaged with a whole host of people, and maybe it'll be a good idea for the folks to understand what we're doing.
Absolutely. So I view the work that we're doing with Root as an accelerant to our life-inspired movement. And the idea is first to get input from team members, providers, board members. We've talked to more than, I think, 700 people who have taken part in providing input on the culture in its current state and what we want the culture to be. The idea then is that we'll take that and package that and go out in team member learning sessions in the fall that will be focused on the need for change and what that life-inspired vision means and how we can bring it to life. So in the feedback, we learned that team members were really engaged in the concept of life-inspired, but they wanted to see more how it really could come to life. And I think this will be a big part of that as we move forward. Another piece of the Root work is that we're also looking at the experience of the team member and the patient, again, part of brand culture. And we're doing 2 pilots, one with primary care and the second with our ortho, spine, and pain center that's opening soon in the marketplace. So the idea is that we can translate those pilots more broadly so that we ultimately create a defined experience across ThedaCare, wherever a patient would go.
Megan, can I add to that?
Yes.
As Megan talked about the fall, we'll get all employees engaged. So the one thing that we ask of employees is to make sure you look for those opportunities to be able to provide feedback, to go through the experience, because it is, as we talked about earlier, tied to our culture. It is our culture. You are our culture. I am the culture. We're all the culture. And we define it in how we act, how we work, and how we live with each other. This is a great experience and a great opportunity for you to participate and help redirect in some ways and advance the culture that we're trying to create to deliver our mission and vision.
I love what both of you said, and often we talk about within our teams that culture is not only defined by the things we say and do, but it's also defined by the things that we don't do and don't say. So when we see something and don't say something, we've actually said something, and we are now defining a new culture, right? So we have to be mindful in terms of how we are creating that culture that lives in our organization. So another exciting opportunity ahead of us is we have our 8th hospital that's going to be opening up soon. And you mentioned, doing a pilot. So for both of you, as whoever wants to go first, what would this brand culture look like in orthopedic, spine, and pain? How do you envision it? Because this is not about creating beautiful buildings, right? This is about that culture, the experience of our team members, and also the experience that we give to our community members. So whoever wishes to go first.
So I'll start from the consumer perspective, and I think the idea is really to think about the promise and how we can drill that down to practical steps. One piece is focused on engaging digitally in a more easy way, the easy button. Other pieces are around how the process within the teams simplifies things to make healthcare easier, and ultimately that that goes into the team experience as well. So those are just a few examples of the elements of the pilot, and you'll hear more about that as well.
Yeah, so I'd say from both the team member and the consumer experience, if I think about, I envision myself walking into OSP as a patient, right? And then I can envision myself as a team member. So as a patient, I think that someone is going to greet me and park my car if it's needed to, if somebody needs to park my car. I'm going to walk in and someone is going to immediately greet me. And it's going to be a place of, I'm going to say at a time when the person or the consumer or the patient is vulnerable. We're going to make it as pleasant an experience as it can be for them. So we're going to make them feel really welcome. We're going to bring them in, and then make it easy for them to get to where they need to get, and then make it easy for them to leave. We'll have food if they want to take food home, prepackaged meals. Somebody will get their car for them again, and then that experience in between. And from a team member experience, I think you have to then have a positive experience across team members as one team, not my portion of the work and your portion of the work. It's our portion of the work. So in order to deliver that consumer experience, we have to live that inside of OSP. So that's how I envision it as a team member and as a consumer or a patient.
Yeah, the last 2 years within the pandemic have been really challenging, and there are challenges all across from a healthcare perspective. But the opportunity really is to, for all of us to come together as Team ThedaCare. We were talking about it this morning in some of our brand culture work. Not necessarily I'm the lab team and I'm the nursing team and I'm the physician group and I'm so-and-so, but how do we all work together to create that culture and the personification of our brand every time there's an experience amongst ourselves and as we deliver that care to our patients? So I hope that, as you've heard Megan and Maggie talk about, what our brand culture looks like, our game changers. The game changers really are the personification of execution of our strategy to become a population health organization. And that's about creating value, predicting, preventing, and creating value in everything that we do. And so as you think about your work, when you live a life inspired, when you are really personifying our mission every day, living those values and principles that Maggie and Megan have just talked about, how are we going to make this come to life in the lives of the people that we are honored and privileged to serve? So thank you for being here today with us. Thank you, Maggie, and thank you, Megan, for your input. And I hope that this is beneficial in terms of understanding our work together and as we move forward to truly create the future of ThedaCare. Thank you.